Most of us tend to get upset or frustrated with ourselves when we can't be our usual selves, whether that is what we're used to doing physically or how we are used to being emotionally. The cancer journey is full of things like this. So many people end up being upset with themselves. You might have thought some of these things yourself. I have to force myself to get anything done. I have gotten so lazy that I'm not doing much of anything. I don't want to do anything these days. I shouldn't be like that. I don't know what's wrong with me. I cry, or I'm worried, or I can't sleep, or maybe all three. I'm snapping at everyone. I hate it when I do that. I get upset about my cancer. I guess I'm throwing myself a pity party. I shouldn't be upset. I should be grateful. Of course, it is normal to be upset that you're having fatigue or emotional distress. What isn't helpful is to turn that on yourself, to call yourself lazy or unmotivated, or to think that you shouldn't be emotional. For example, instead of being self-critical and calling yourself lazy or saying, "I don't seem to care anymore," you might want to remind yourself that you're going through cancer treatment and fatigue is a side effect. You're not lazy, you're tired. Instead of thinking there's something wrong with you for crying or worrying, try reminding yourself that most people going through cancer feel upset. It's a normal thing to feel in an abnormal, difficult situation. The same goes for being snappy or irritable. It's pretty understandable that someone going through cancer might be more touchy than is usual for them. One of the ways to tell if you're being hard on yourself is to ask yourself, would I say this to another person in a similar situation? Would you tell them that they were being lazy? Would you say to another cancer patient, "I don't know why you're so upset"? Being self-critical is so common that most people will agree with sayings like, "I am my own worst critic," or "I'm harder on myself than I am on anyone else." You may have been this way before cancer. Unfortunately, when it comes to cancer, there are so many changes that give us so many opportunities to be self-critical that this tendency can make a difficult journey even more difficult. So, why are we so hard on ourselves? I think at least one reason is that we think that criticizing ourselves is a good way to change things we don't like in ourselves. Somehow we think, if I just get mad enough at myself, I'll quit smoking, or I'll stop being snappy. If I just hate myself enough, I will quit eating or get more done. Put that way, it doesn't seem like it would work. And research shows us that it doesn't work well at all and makes us miserable in the process. More important, when it comes to cancer, many of the things that people criticize themselves for are not their fault or even under their control. Being critical or mad at yourself does not give you less fatigue, get more done, or help you feel better physically or emotionally. So if being hard on yourself doesn't help, what does? Being kind to yourself. Understanding that this is a hard time in your life. Try to be as understanding of yourself as you would be to a friend. Sometimes when I say this, people say, "But I don't know how to do that." So here's some ideas. First, ask yourself, what would I say to someone else who is going through this? Fatigue, emotional upset, whatever. You are very likely to come up with a wiser and kinder response to someone else than to yourself. Then say that to yourself. It's no wonder you're tired and can't do what you want to do. And it's human to be upset about that. But don't blame yourself. You're doing your best. Another way to encourage kindness to yourself is what I call the compassion formula. Of course, I'm not getting much done, cranky, frustrated. That's because I'm human, or I'm in chemo, or I'm scared. And I'm working on that, and that will get better. I'm doing the best I can. Another good way to be kind to yourself is to set reasonable expectations. What would you think if you heard someone who is going through cancer treatment say, "I'm so mad at myself. I used to be able to get so much done, and now I can't even make dinner"? I'm pretty sure you would tell them that it isn't fair for them to have the same expectations of themselves as they had before cancer. It's important for you to set reasonable expectations for yourself. It's human to want to do everything you used to do and to feel sorrow that you can't, but please be careful about being angry with yourself. You also might find that your expectations will need to change day to day, especially during chemotherapy. You will find your rhythm, the days that you can do more and the days that you will need to rest. Remind yourself that no matter what you're doing your current best, and that is enough.